Bill Clinton, the man that Obama turned to in 2012 to save his re-election hopes, was asked in a recent interview about Obama's claim that if you like your plan, you can keep your plan. If you like your doctor, you can keep your doctor. Watch this.
So I personally believe, even if it takes a change in the law, the president should honor the commitment the federal government made to those people and let them keep what they got.
Now, you know when things are really bad, when Bill Clinton, one of the most prominent voices, if not the most prominent voice in the Democratic Party, calls on the president to man up and keep his word. And by the way, let's not forget Obama said this about his buddy Bill after his 2012 DNC speech.
President Clinton made the case in the way only he can. You know, somebody emailed me after his speech and said, you need to appoint him Secretary of Explaining Stuff. That's pretty good. I like that. Secretary of Explaining Stuff.
Ouch. Now, President Obama may need to tweak that comment now, or maybe add an if to that statement, too. But Clinton is not the only liberal now pulling back from the anointed one. Democratic Congressman Kurt Schrader, in a recent interview, said this about the president.
I think the president was grossly misleading to the American public. He knew right away, I know right away as a veterinarian, I had my own business, that my policies got canceled, even before the Affordable Care Act. I know that I would change policies on a regular basis, trying to find the best deal for myself and my employees. But a lot of Americans, a lot of Oregonians, have stayed with the same policy for a number of years and, are shocked that their policy got canceled.
Grossly misleading, or maybe lied. Joining me now with reaction, two men leading the charge in both the House and the Senate to force the president into keeping his word, Congressman Tom Cotton and Senator Ron Johnson. Guys, welcome back to the program.
Well, Sean. Hi, Sean. Great to be on.
All right, Senator, before we get to the if you like your plan, you can keep your plan act, which you proposed in the Senate, now the House has their version. I think I've studied the Clintons pretty well. Bill Clinton doesn't do anything without thinking it through. James Carville was talking about the president toking on a crack pipe yesterday. President Clinton saying this today. Seems to me the Clintons have designed these remarks to kind of give a wink and nod to Democrats, get out of this. How do you interpret them?
Well, that may be, but let's face it. I'm just going to show how bipartisan I am. I totally agree with President Clinton when he says that the President Obama ought to honor that promise. And let's face it, Sean, what President Obama did is he basically perpetrated a massive political fraud on America. If that occurred in the private sector, that massive consumer fraud, that would be subject to criminal charges. So I really do believe that former President Clinton is absolutely right. President Obama ought to honor that promise and start working with people like Congressman Cotton and myself to start fixing that damage.
What do you think, Congressman?
I have to agree with Senator Johnson, and I agree with my fellow Arkansan, President Clinton. The Democratic Party should step forward to fix the mess they made with Obamacare, and President Obama should keep his promise. He clearly knew, going back to the summer of 2010, that millions of Americans, tens of thousands of Arkansans, were going to lose their health insurance. And that's what's happening right now among individuals buying individual policies. But I'm starting to hear as well from people at small businesses who are starting to lose their policies as well, or see their premiums double or triple, or see their co-pays go up. We need to take action in the Senate and the House to make this right.
You talk about those 2010 numbers. You're talking about July 2010, and that's when they were having an internal debate inside the White House whether or not to tell the American people, to tell everybody watching the truth about the numbers and those that would lose their health care plans. Those estimates, we've had analysts on this program say that number will be as high as 100 million. As you look at their own estimates, what do you conclude?
Well, Sean, first of all, it is absolutely correct that 40 to 67% of individuals will lose their individual policies. But listen, I bought health care in my business for 31 years. The incentives in Obamacare are all for employers to drop the coverage, not pay $15,000 for a family plan, but pay the $2,000 penalty and make their employees eligible for the huge subsidies and the exchanges. So that was the design of Obamacare, to basically, put as many Americans into those government-run exchanges as the first step toward a movement toward a single-payer system.
Yeah, well, Congressman, because the estimates, their own estimates, in July of 2010 was 70% of individuals would lose their plans, 65% of small business owners, they would funnel them into the system, and 45% of even big business. Now we see the enrollment rate is what, 90% lower than they expected. Don't these low enrollment figures undermine the law's financial stability? Isn't it predicated on huge numbers of people signing up? Does this now render the law unsustainable right now?
I'm afraid, Sean, that it might. The president has